My name is Yvonne Coghill and I am the Director of the Workforce Race Equality Standard. I started my nurse training in 1977 and I've been working in the NHS for 41 years. I'm a nurse, I'm a health visitor and I'm a mental health nurse. The data my team produces is invaluable to everybody in the NHS. It means that people will have clarity about the situations that they find themselves in. It means that organisations can see very clearly that if you're from a black and minority ethnic background, the experiences that you have are very different from the experiences of your white colleagues. It means that they can use the data to start closing the gap on experience between black and ethnic minority staff and white staff, therefore ensuring that all of our patients have a safe service, are cared for well and have a satisfactory service. What we do is we collect data from all of the provider organisations in the NHS on the experience of black and ethnic minority staff and white staff using 9 indicators. We need to have nurse leaders who are switched on to this agenda and understand the importance of having a workforce that is valued regardless of their background, regardless of who they are. I don't believe that people are deliberately discriminatory on a personal basis. I just believe that the systems that we have developed over many, many years give us perfectly what we've got. And what good looks like to many, many people in the NHS are white middle class people and not people from black and ethnic minority backgrounds. Subsequently, there's something about fit. And when people go for interview, it's not necessarily about your qualifications and your experience, it's about fit. Therefore, we have to change the processes to get people to understand that in order to have a fully inclusive and diverse workforce that works for all patients, we have to start changing those processes and people's thinking. There's something about us working with each other and understanding each other more and talking to each other, whether we're black, Asian, Chinese, it doesn't matter. We have to understand that we're all here for the patients. And if people are doing things incorrectly and you're a senior leader, you have to have the responsibility to actually have those conversations with those individuals in a professional way. The fitness to practice strategy, the new strategy, I think is very, very good, and I think will enable employers to think really hard and think twice about referring people to the NMC. Why? I think because it gives them the opportunity to really sit back and think about the importance of diversity, of valuing staff, and thinking about how we can actually make a difference ourselves without referring people on to the NMC. Organisations need to take responsibility for all of their staff, and they need to think about ways in which they can diffuse situations and make things better for all their staffs themselves.